I've realized that it's just not black and white. Life isn't black and white. Dealing with people, relating with people is not black and white.
Toyin, thank you very much for coming on here and agreeing to have this conversation with myself. How are you doing today?
I'm good, thanks. Really good.
Good. Right, we'll just go straight in. Just starting off, tell us a little bit about yourself, your background, your upbringing, that sort of thing. Okay,
so I'm a dentist. I've been qualified for 7 years now, and it's been quite an interesting journey to get to this point. So I'm currently in private practice after transitioning from the NHS earlier this year. A bit about me. Yeah, I'm just a passionate person, generally quite motivated and driven, and really do love what I do. So very passionate about dentistry, and it's been quite an interesting journey to get to this point. For me, childhood was there were many challenges, actually, being very honest. So the main thing is I'm a twin and I have a younger sister, and I've always lived within the same area, which is Brixton, which was notorious for being quite a rough area for many years up until more recently. But within that, first of all, I was born in Nigeria, then moved to London, UK, where we settled in Brixton, and that was pretty much where we've stayed since. So when the most important and significant change that happened in my childhood was my dad passing at the age of 10, and so that completely changed everything. So grew up in a single parent household. Following on from that, my mum's a really strong woman, and yeah, she ensured that we stayed safe in Brixton. So she was very protective and quite strict, but actually, considering the environment that I grew up in, I think that was very necessary for us to become, for myself and my sisters, to become the women we are today. And so, yeah, a lot of childhood memories were quite challenging, but when I look back on it, I can see how those very challenges have kind of developed me into the woman that I am today. Very tenacious, I don't take no for an answer. Yeah, and if there's a challenge, I'm going to find a way around it to get to the outcome that I'm after.
Brilliant. No, it sounds like you've been through quite a lot there to get to where you are today. Obviously, you mentioned being a dentist. Is that what you always wanted to be when you were younger?
No, actually. So I was obsessed with maths. I was like a proper geek. I loved maths, and I remember when I was younger in secondary school, I used to say, I'm going to become a mathematician, and I had no idea what that meant really. I just knew that I really wanted to study maths, and I remember being laughed at for that, so I kind of dismissed that idea, and so I didn't know what I wanted to do. And funny enough, we had a maths tutor, myself and my sister. So after school, he used to tutor us, and it was actually off his suggestion of doing dentistry that I found that path. Initially, when he recommended it, I think this was when I was doing my GCSEs, he said, okay, why don't you consider dentistry? Because at this point I had no idea what I wanted to do. I'd written off maths, and I knew I definitely did not want to become a doctor. And so I said no to the idea, just thought, no thanks, why would I want to become a dentist? And then later on, still not having a clue what I wanted to do, I decided to do the work experience. And even at that point, I wasn't completely sold on the idea, but after shadowing a dentist for a week, I thought, you know what, this seems like the right mix of things that I'm after in a career. Dentistry being creative, also lots of problem solving, working with people, helping people. And so I made a decision to choose dentistry, and then the passion and everything else kind of followed suit. With, I guess the passion has developed as a result of the challenges that I faced within dentistry. So it's fueled my determination within that field more.
Yeah, and tell me a bit about some of the challenges that you've faced, even within dentistry, and up until where you are today.
The challenges I originally faced within dental school were not feeling like I belonged in that environment. And even the reason for that was, even though I was aware that I was highly motivated, really excited to start this journey. Prior to dental school, I didn't know any dentists. So for me to get to the point I was, it was self-driven. And so when I got into the dental school environment, I felt out of my depth. I felt like an imposter. I felt like I wasn't worthy of being in that environment. I felt like everybody else had been to a private school, and I'm coming from Brixton. I was quite embarrassed, I think, without actually acknowledging that was the issue. So yeah, the main issue in dental school was feeling like I didn't belong, and that actually caused me to distance myself during my degree. And so I struggled because I'd isolated myself. I wasn't at the forefront of the group. I was kind of ignored, and I really did need help in terms of financially, in terms of moral support, confidence boosting. None of that was there. I did find support in friends outside of dental school. In fact, I spent a lot of my dental degree hanging out with lawyers. But somehow, through various challenges in dental school, I qualified. And I'd say in terms of after graduating, I have taken on a range of jobs, very different jobs within dentistry. And what I have seen since graduating is the importance of mentorship. And so, in fact, where maybe coming from a single parent household and feeling like subconsciously, I don't know if any other single parent child or adult feels like this, where because you're missing one parent, you're not good enough, you don't have what other people have. I think it does kind of generate this seed of unworthiness. And so qualifying from dental school and meeting amazing mentors, they played a massive part in helping me develop my own self-confidence. And so I think, in a crazy way, qualifying from dental school, meeting amazing mentors, brought my kind of adulthood to a full transition, full circle of not having a dad to having mentors to make up for that in terms of building my self-confidence.
Tell me a bit about what kind of things did you start doing to kind of, get better and, live up to those challenges that you were facing?
I think a lot of what I've done has been subconscious. In terms of it was not at the forefront of my mind that I was on a journey of self-development. I would say what I was very intentional about was a journey of professional development. And because I faced so many challenges within dental school, failures, health issues, massive anxiety attacks, all those things made me feel like I didn't get the best experience out of dental school. And so I was very intentional about just becoming the best dentist I could and really developing a strong foundation within dentistry. And so that took me on this path of, first of all, working as a locum hygienist for a few months after qualifying, which is not the conventional thing that's done after qualifying. Most people get a foundation training job straight away. I didn't. And so actually working in that environment, really working as a hygienist in different practices across London, really developed my confidence. And I realized the importance of being able to communicate with patients and being in control of a space, a dental space. So that was the first thing that really, technically it was a job, but it really helped me to realize that I actually do have the skills to work in this dental environment. I'm good with patients and I'm adaptable. And so with acknowledging that, I then applied for my foundation training program again. I got a really good place, and I was down the road from where I live, so that works well. And following on from that foundation training, I ended up doing hospital jobs across the UK, really up north and down south. And really, those experiences were targeted at me developing my clinical skills, specifically my weaknesses, so oral surgery, and just things that I knew that I wanted to get better at. Those things were achieved, and again, because I was in very different environments to home, I was by myself and having to meet new people. It really allowed me to just develop my self-confidence. And as I mentioned earlier, meeting mentors along the way, they were really, really important in they almost held up a mirror and said, Toyin, this is you. These are your strengths. You're intelligent, you're hardworking, and you're going to go far in dentistry. But they were kind and honest, and they also said, these are the things that you need to work on. You need to be more organized. And so those are the things I was able to take on board to become a better clinician, better dentist. But actually, the things that they showed me about myself allowed me to work on myself subconsciously. So I took on board those things and realized, okay, I do need to be more organized. But actually, I have a lot to bring to the table, and things that I'd never heard before. I never thought I was intelligent, despite the fact I was so hardworking and even from childhood done really, really well. Always felt like I let myself down because I knew I could do better. But hearing that I'm an intelligent person meant, okay, I have the potential, and if I really apply myself, there is a lot more that I can bring to the table. And so those are the things I focused on, really. Being passionate about volunteering. I've always done something relating with people. And so in a nutshell, it's just been a journey of development. And fortunately, I've been around people that have been honest and allowed me to be my authentic self. And through that, I've been able to really just grow as a person.
Fantastic. That sounds great. And obviously, talking about mentors as well. Tell me a bit about, how did you get these mentors? Because obviously, is it just people that you met along the way and thought you're going to be my mentor? You know, how did you start that
Yeah.
relationship?
Literally, it just happened. And the actually, to be honest, these mentors came about through, it was their job to mentor me. So the first mentor I had was in my foundation practice. He was just it was his job to supervise me in the clinical environment, but it was the small details that he noticed about me that allowed that relationship to blossom. So I did my foundation training 6 years ago, perhaps, and up until this day, I'm still very close with my foundation trainer. I still say he's my mentor, to the point where I'd call him my dental dad now, because he noticed very early on the potential that I had. And so even in the foundation training, he would always be very open about speaking my strengths and also being honest about the things that I need to work on, and he would push me. And so it just kind of naturally blossomed, really. And the other mentors I have, exactly the same scenario. They were doing their job. So in the hospital post, you have a trainer, a supervisor, and so these very people became my mentors. So they did their job, but they went above and beyond their job requirement to make sure that I got what I needed to become a better clinician and to develop on a personal level. So I never once went looking for these people, and I don't think it was their intention that they were going to be so fundamental in my development journey, but it just kind of happened. And yeah, I guess it's a testament, because actually there have been job situations that I found myself in, following on from these training jobs, where I felt like actually I'm not getting the feedback that I need in a way that's going to be constructive. I've felt at times where I've just received criticism without the positive feedback. And in those situations, I can see where when there isn't mentorship, and you're in a position of leadership and influence, it can be quite detrimental when you don't take time to really support people as they need it. So I've had good mentors, I've had not so good mentors, and even the not so good mentors have been important. They've allowed me to see that I can also thrive without validation from others. And so life just works out, and whoever you meet, they serve a purpose, and they might not stay in your life for long, but there's always something you can take from experiences with people.
Yeah, fantastic. Because yeah, that you are right. Like the with mentors, you know, they come, they go, and everyone has some people that come into your life. And it's almost
Mm,
like, from what I'm hearing, it sounds like you chose to make those mentorships count. So it wasn't just like,
mm,
oh, that's their job, and oh, I'm just gonna let them do their job. But it was, what can I take from this? What can I really use from this? How can I, you know, use this to the best that I can? So now that sounds absolutely amazing. Mentorship. So one thing that you talked about is feedback, criticism. What have you learned about receiving feedback, receiving criticism? How do you use that in the best possible way?
that's a great question. I would say with feedback, I think it's an interesting one because in situations where you receive criticism, even if the feedback is negative, I'm someone that believes that I can learn from anyone. And I think it is worth taking this with a pinch of salt. So someone could tell you a fact about yourself and it could be true, but they may say it from a place of maybe trying to make you feel small, or manipulation, or trying to get you to do something. And so they say, this is what you do, can you work on it? Or it comes across in a way where you just don't feel good about yourself. I think in those situations, I still am open to receiving feedback. And so I kind of pause and say, what am I hearing? What about myself can I work on with this information? So taking away the emotions from it and stripping it back to the fact, this is an area that I need to work on. So in those situations, that's exactly what I do. And when there's good feedback, it's easier to hear what is good and say, okay, this is a strength, and this is what I'm going to continue to work on. So when I hear the negative feedback, even if it's from a bad place, which sometimes it might not be, but if I'm sensitive about a particular topic, I may perceive that it's a negative feedback when actually the person's trying to be helpful. But regardless, in those situations, I'm going to think, okay, here's a weakness and I need to work on it. And I will take it away, journal, whatever I need to do to turn it into an action point. So that's what I do with all types of feedback. But I'd say what I've learned the most is I have to work on how I give feedback and how I respond to feedback. That's just as important as receiving it. In terms of receiving feedback, it can be, if it's something that's quite sensitive, it's very easy for me to respond, or anyone else to respond, in a way where you feel like you're being attacked or targeted. And in those situations, you have to pause and take a step back from the situation and hear what is actually being said without the emotions. And it's not your job to interpret the person's intention behind what they're saying, but it is your responsibility as to what you do with it and what you make of that information. And in terms of me giving feedback, I've realized that I can be my intention is always good and I want to be helpful, but sometimes the language used can come across as if I'm being negative. So it's clear that lots of people probably have the same issue of not being able to give feedback in a way where it comes across kind, when that is exactly what you'd want to do. So I think I've just learned how important communicating is. It's important to be able to think of the end in mind. What are you actually trying to say? And find the appropriate language to get that across to people.
Yeah, fantastic. And talking about communication, feedback, criticism, obviously, it's a thing that I always come across that I find very interesting when I speak to dentists is the relationships between dentists, principals, dentists, and their nurses. You know, tell me a bit about that. How have you found navigating those relationships?
I've learned a lot this year. A lot. I
Yeah.
think prior to this year, I would have sounded very optimistic and yeah, I'm a people person, so I have no problems with anyone. And this year, I've realized that it's just not black and white. Life isn't
Mm.
black and white. Dealing with people, relating with people is not black and white. I think in terms of relationship between principal dentist and associate dentist, yeah, where do I begin? I would say what the most important thing in that relationship is understanding the roles and responsibilities. And before anything else, in terms of friendship, relationship, or mentorship, any of those, it's important that the job role and responsibilities are met. It's important that expectations are clear and that both parties know where they stand with each other in terms of this is your job. You're meant to see patients as an associate, treat people well, communicate well, get to work on time, see patients in an efficient manner, work to your targets. And the principal, their job is to supervise the staff to ensure that you're remunerated. All these things, they're just basics, but sometimes if those fundamentals are not addressed, it can easily cause conflict. So that's just the standard initially. But I think in terms of a really fruitful relationship between a principal dentist and associate dentist is one where the associate is allowed to thrive in that environment and allowed to be authentically themselves and bring their best self to that space. Of course, everyone has weaknesses that they need to address, and it should also be a safe space where, when those weaknesses are presented in situations, that there is honest and constructive feedback given. It shouldn't be a space where an associate is made to feel small or uncomfortable or insecure, and vice versa. If associate finds there are issues, they should feel that they're in a space where they can be honest with their principal dentist and they're not going to be someone that's proud or arrogant or not look down on them and say you're just an associate, I'm not going to hear this. And actually it's the same with associate dentists and nurses. Everyone within the dental team should feel like their voice is valid, their opinions are valid, and they're in a space where they can be authentically themselves. And that's where people thrive the most. And I think also everybody, if you're in dentistry, you're probably someone who is on a journey of self-development, professional development. We're very competitive. And I think it's important that there is always that space for growth. It may be taken on more Invisalign cases if that's what the dentist chooses to do so. And also for nurses and other members of the team, there should always be that space for further development and incentive to do better. And that may look different for different people based on what they value the most. But ultimately, aside from clear roles and responsibilities, honest relationship, open relationship is really important in those environments.
Okay, and obviously relationship. What are some of the things that you would say principals or even dentists and nurses? What are some of the things that people can do to build that relationship? Would you say, in your experience?
Okay, I would say number one, team building. Team building is a fantastic way of being able to see people interact. Let's say you do a competition or you go for a group event, especially when the competition is involved, you see who are the people that step up to a challenge, who are the natural leaders, who are those that shy away, who are those that support the rest of the team. When activities like that are done outside of the work environment, it's an opportunity for people to understand each other better, but also it does allow for the team bond to be strengthened. Aside from the group activities, I'd say appraisals are essential in terms of being able to have one-on-one sessions in a safe space where open, honest feedback is given. And I think one thing I've noticed that's so key about feedback is examples. You can't say you've noticed someone about something without having the evidence to back that statement. And so with appraisals, there needs to be examples given. There needs to be goal setting towards the end of the appraisal, perhaps. But I think appraisals are a great way to continually push members of staff, encourage members of staff to be, number one, accountable, but also motivated to strive for excellence. Other things that I would say work well would probably be some kind of, not a bonus system, but a reward system in place for members of staff that are willing to go the extra mile. I think it's easy to give negative feedback, but it's so much more important for people to feel valued and for people to hear that they're doing a good job. That motivates anyone. Whereas criticism, it limits you, it stifles you. Mm-hmm. So just finding ways to show that your team are appreciated really goes a long way.
Fantastic. And one of the things that you mentioned when we talked about a bit of personal development, you mentioned journaling. If you could just tell us a bit about that, and also any other tools or things that you do to grow as a person.
Yeah, I say journaling for me is just a way to process my thoughts and document them. Sometimes I read back my journals and I laugh. I think some of it, you realize that we can really get caught up in our own feelings and take things the wrong way or blow things out of proportion when we're led by our emotions. So it is good to journal just to air out how you're feeling, but also to reflect on things that have happened and how you've processed it. Other things that I do are actually talk to people, not necessarily at work, but friends that are close and family that they know me well and that are on my team. They're there to support. It's not every workspace, unfortunately, that you're going to find people that you can trust or feel like you can be completely yourself around. And so in those situations, it's just nice to know that you can have someone outside of the workspace that you can say, this is what happened, and they're able to support you and say, okay, I know you well. I know this is probably what you could have done better in that situation, but hey, you're not a complete write-off in this situation. So having friends that are on my side or there to support me helps. Mentors are fantastic, because this year I can say that my mentors have really helped me, even when they're not in my direct work environment. They have known me from when I started off as a young dentist, and they've seen the changes. And so they can also call out the things that other people may have said that don't match my character, because we have that relationship. So in a way, it's just a way of sifting out what's happened in life and allowing me to take on board, these are the things that I can learn from it, but actually these things are not valid because they don't match my character, and maybe there's a flaw in someone else that's part of that situation that's been picked up on. So I really think I've learned a lot about the value of people, friends and family, and having a support system. Ultimately, without a support system, it's easy to crumble. And also that the support system have allowed me to say, you know what, dentistry is not everything. I love dentistry, I'm passionate about it, but there are times when it can really just consume your whole life. And this year I would confess and say that I realized I'm a workaholic. And so my support system were able to say, you know, it's great you're passionate about your job, but how much time do you have for other things? Like, what are your hobbies? I'm like, I don't know. I love studying dentistry. That's a hobby. No, it's not a hobby. It's not a hobby. But yeah, your support system just allows you to take a step back when you can get too engrossed into work or whatever it may be.
Yeah, fantastic. I think the thing that I hear a lot that you're talking about is, you know, a lot of taking feedback, you know, from people and acting on that feedback instead of just it coming in one ear and going out the other. And let's talk a bit more dentistry. So let's talk a bit about, you know, professional development. So what are some things that you've done to develop yourself as a professional?
So I've been on a number of courses. So from qualifying, I've done dental core training. So working up north in hospitals, doing max vax, ortho, restorative. pretty much every dental specialty. I've done the hospital training attached to it. So that allowed me to really get a broad depth of the different specialties and what I'm interested in. Other things that have helped with my professional development are specific courses. The most recent one was a 1-year course, cosmetic dentistry course, which just completely changed everything. And I went from working at NHS practice to transitioning into private practice. Specifically after doing that course, it just changed the way that I wanted to work going forward. Other courses that I've been on are ethical selling courses, self-confidence courses. I've stopped going on as many dental courses because I realized that I actually do know a lot. But with all these courses, it requires you to take action. And I've realized more recently that if I'm lacking self-confidence or self-belief, then there's only so far these professional academic courses can take me. And there's only so far I can get in my career, regardless of anything I pay for, equipment that I buy, because ultimately it's down to me how successful I am. And it's essentially for myself is conquering my fears. And so the biggest thing that I would say that has changed that's allowed me to develop professionally is actually taking a step back from dentistry and reducing how many days I work. And with that, having more time to process all the courses I've done, everything that I've learned over the past 7 years, consolidating that, and then applying that to the practice I'm in now, and where I want to be, and setting some goals and some systems in place to really propel me further in my career. So it's actually pausing, taking account of everything so far, and then strategizing what I want to do going forward, which allows me to be more in control of my career. And I don't think enough of us do that, because naturally a lot of us are in autopilot mode. Autopilot mode may just mean courses, more patients, more treatment, but without that depth of understanding, which takes time and intentionality. And so that's the path I'm on at the moment.
Okay, so that's very interesting actually, because at the end of the day, sometimes people can feel like the more courses I go on, but the more I progress. But like, even from what you're saying, it sounds like you could go on all of these courses, but if you're not even giving yourself time to process these courses or anything like that, they become a bit pointless. And obviously, you talked about also being able to hone your skills and specialize. And so, what do you think about that? Like, there's people who they do everything, and there's people that decide, you know what, I'm going to stick to this thing. Tell me a bit of your thoughts on that.
I think you could do everything. Dentistry is great because there's so much variety and you can choose the path that you go down. Of course, if you focus on one specialty or one aspect of dentistry, you can really hone in your skills and become a master of that. But it depends on whether you're someone that likes variety or you like to do the same thing every day within clinical practice. So it's down to preference, but I think more than anything, it's about being intentional about getting better. And for me, I actually love general dentistry. I love endo, I love extractions, I love everything. But I am particularly passionate about aesthetic dentistry, in terms of being able to visualize with the patient, okay, this is how they've presented, and this is what they want their final smile to look like. And I know that's me because I'm a very visual person, very creative, and I do like aesthetics. So that particular aspect of dentistry works well for me. But because I like everything, what I'm realizing is I can do all general aspects of dentistry, but what's most important is when things go wrong or when a treatment plan doesn't go to plan. If a tooth chips and I've done the treatment, it's pausing to realize what went wrong and identifying how I can make things better next time. So it doesn't matter what you do as long as you're on that path of continual self-reflection. That's it in a nutshell. I don't think there's a hard and fast rule that fits everyone. It's just making the most of what you've got, extracting every bit of opportunity from whatever situation you find yourself in, and then applying that to going forward to get in further in whatever it is you want to do.
Yeah, brilliant. And one thing that I've noticed is obviously there's been a bit of a shift in dentistry, which is that now dentists, we have the Instagram dentists, and we have dentists are having more and more to market their services and that sort of thing. So again, obviously you have this, sparkling clean Instagram page, and everything, is
Yeah.
in its place, and it looks, very good. Tell me a bit about that. How do you transition from just going to, I need to practice my dental skills, but now I have to be on Instagram. I have to do this for me to be able to do the kind of treatments I want to do more of. Tell me a bit about that.
I don't actually think I fit the status quo when it comes to dental Instagram pages. I don't even have a single picture of any treatment that I've done. And for myself, the dental page was more of a way of giving back the information that I've gathered about oral health and things like that, and being able to just provide that information on a social media platform. So that was the incentive behind the Instagram page initially. I do plan on changing it, and eventually I will add more content of treatment that I've done. But it's also, I've realized that that's what everybody else does, and there is absolutely no problem with me doing that. But I need to get to that place of fully understanding why I've taken that step. And so at the moment, I'm still kind of processing what do I want my page to transition into, because you're right, it does look very picture perfect. Everything is color coded, and I think I'm at the point where I'm like, this looks perfect, but perfect isn't enough anymore. Authenticity is much more important. And so with the dental Instagram pages that I see a lot of cases, and I'm like, oh, this is fantastic. I want to be at that level of dentistry. But I'm going to take my time and get in there, because sometimes social media and seeing what other dentists do just puts that massive pressure to perform to that standard. And the problem with social media is it's images most of the time. We don't get the background into how long that case took, or how difficult the case was, or how difficult the patient was. There is no insight into the journey to get to the end point, which is this beautiful aesthetic picture. And so this year, actually, I've really taken a step back from social media, and I guess I'm on a journey of understanding myself better as a person, as a clinician, before producing more content to deliver to the world. Because I always want every post to be intentional, and with each post be able to say, yeah, this is why I did that post. I didn't just do it because it was another case, but there's a story to tell behind each post. And I think that is where authenticity shines through. There's more likely to be patient engagement. So yeah, that's me. Always a bit controversial.
No, that sounds really good. And even talking about that, because obviously I do know a lot of people, do have confidence issues around social media, for various different reasons. And what is, maybe tell me a bit about your journey when it comes to like things like confidence around social media, how people can, get to a place where, they can post and be free to do it, and in a way that's authentic to themselves. Yeah.
Yeah, I think what allows me to enjoy social media is the fact that I'm not doing it for other people. It's something that was this I randomly came up with Dr. Toyin Smiles, and it was organically produced. Every single post, as perfect as it looks, is organic. It came from a random thought. It came from an experience. And there's been times when I'll try and produce content and it just doesn't happen. And I'm just like, well, oh well, there's nothing I can do, or I'm busy with other priorities in life. So for me, the confidence comes from the fact that this is me. Even the fact that everything is perfectly the colors are aligned, all of that is a reflection of my personality. Yeah, I did discover also this year that there is a tendency to perfectionism, and so the page reflects that very clearly. And these are things I'm working on. So the confidence comes from being myself and not apologizing for it, because social media is the platform for me to be myself. It's like art. It's an expression of me. So my page is that. So also, because I know it's an expression of me, I think with social media, you have to be at the point where the validation that you're seeking is internal rather than from other people. Because if I post something and it doesn't receive that many likes or it gets backlash, I have to be prepared to say, that's okay, that's your opinion, but I'm not going to apologize for the fact that this is where I'm at. So really, it is I think social media is a big test of confidence. But for anyone who's feeling nervous about it, I'd say perhaps just really take your time to understand why you're doing it. If the why is strong enough, then when the challenges come or the writer's block comes and there's no inspiration comes, you'll always have enough to keep you going. So if the why is just because everybody else is doing it, you will soon burn out or end up in a place where you're feeling pressure to deliver what everybody else is doing, and then you kind of start rushing patient treatments, or not really, you see a patient and you're thinking this is going to make a great Instagram post rather than treating the patient for who they are. So what I would say is really be careful about your motives, and if your motives are genuine, you will find enough drive to keep going. And there is no race. Social media is here to stay. So the most important thing, I guess, is taking a step and not feeling the pressure to rush the process. I always think when things are rushed, they don't last. So it's about doing things consistently and well, and that can be slowly. That's okay as well.
Fantastic. Perfectly said. And I'm just weary of the time as well. What would you say to yourself? So if you had to go back to imagine the little Toyin in the middle of Brixton somewhere, you know, what would you say to yourself, having experienced everything that you've experienced now, having your life turning out the way it is now? What would you say to yourself?
I'd say, good job. I'd say to myself, wow, you didn't think you'd get this far, did you? Yeah, I really, when I think back, and the irony is I'm still living in Brixton. I'm still living in exactly the same house that I lived, what, 20 plus years ago. So it is quite strange to be at a full circle, and I will be moving out of Brixton soon. But I'm so proud of my achievements, and I think a lot of the time we don't give ourselves enough credit. I've worked very, very hard to get to this point, and a lot of it actually has been self-motivated. So as much as my mentors have been there, and I've had amazing opportunities, I've actually been the one to pioneer those opportunities. I've done things that people have said are crazy. I've done things that nobody else has thought to do before, and yeah, I can definitely say to my younger me, well done. And you probably didn't need to worry so much when things went quiet or if things didn't go the way I planned, because it was all part of the journey. And those very setbacks were the opportunities for me to do something unique, to stand out, and to bring something exceptional to the table.
That was perfect ending. I'm not even going to ask any more questions after that. No, that was perfect. Thank you very much, Toyin. This has been absolutely amazing and very enlightening, very eye-opening. I'm sure a lot of people will benefit from it.
Thank you. Thank you for having me.